So Karen, this week we submitted our application for Pathways, and I was just thinking, gosh, this sure seems like a lot of work. Why are we doing this?
Well, Donna, we are doing the Pathway to Excellence because there's really nothing in it for the leaders, but it is for the staff. From a staff standpoint, the whole idea is to build a professional practice environment where the staff feel like they're supported and they can have input into decision making. They feel positive about working at Parkland and have a great pride in working at Parkland. And by implementing the standards, the standards serve as a roadmap for Parkland to be able to implement this positive practice environment. As leaders, as you know, there's really nothing in it for the leaders. There's a lot of hard work. It's a lot of effort. It's not an easy accomplishment. However, we know that it could benefit the staff and implement an environment where they feel very positive about the work they're doing.
Well, it does seem like in orientation, nurses often ask us if we're going to be on the magnet journey. And with the Dallas hospitals all being magnet, it seems like there's a lot of pressure as well.
There is a lot of pressure, and it's true in orientation. When we go to orientation, the nurses say, are you on the magnet journey? Are you doing anything around shared governance, unit-based councils, and so forth? And we have to be competitive in this environment. Our unemployment rate here is below 4% in the Dallas-Fort Worth area, in the Metroplex. As a result, we want to be competitive, and as a safety net hospital, we really want to have that positive practice environment, and this allows us to be able to implement similar things that other health systems around the country and locally are doing.
Well, I also hear sometimes from the nurses that it seems like we're all about the awards and the degrees and the certifications.
Well, I hear that as well, but what we want to do is give any nurses that want to advance their practice, if they want to become certified, advance their education, transfer to a different unit or a different area where you can learn new skills, we want to offer that opportunity. We certainly don't expect everybody to go back to school, and we won't have everyone certified, but we do want all of our nurses to feel like they have some advancement capability, whether it's continuing education or any type of endeavor that might help them advance their practice.
That sounds great. Well, now that we've submitted our application, what's the next thing? I hear it's a survey. Is that what's going to happen next?
Yes, we submitted our documents on Tuesday, and as soon as those are accepted, we will have a date for a survey. The survey will come to the staff's email, and then the staff will complete the survey. What's important about the survey is, as we sent our 860-page document in, it is a validation survey. This is not a perception survey. It is a validation survey that we indeed do have examples that meet the Pathway to Excellence standards. Each unit, when you take the survey, will not have met all of those standards because that's impossible. Mm-hmm. However, what we're sure of is that Parkland has met the standards, whether that standard is met in the jail or in homes or clinics or in the medical center. So we feel confident that we have met the standards. The other part of taking the survey is there's a neutral choice. If you aren't aware, you can take the neutral stand on the question, and that doesn't really count against us. So that's another way to approach it. But we're used to taking perception surveys, but that's not what this is. It's truly a validation survey.
Wow, well, it sounds like it's a great time to be a nurse at Parkland. Jump on the Pathway Express with us.
Yes, get on the train. Thank you.